My name is Hannah Wild. I'm a surgical resident at the University of Washington, and my career-long focus is improving casualty care in low-resource conflict settings. As part of this, and in acknowledgement of the increasing toll of explosive weapons indiscriminately, we began our working group, the Explosive Weapons Trauma Care Collective, or EXTRACT, which has the goal of adapting in a context-appropriate manner trauma care advances from high-resource systems to low-resource conflict settings. One clearly adaptable intervention, if one takes, for example, what the US military calls its tactical combat casualty care, in which not only military medics, but all personnel serving in a combat role are trained in basic emergency first aid measures to bring care closer to point of injury prior to evacuation. There's no reason this can't be done, even in low resource environments, and it actually has quite successfully. A group called the Tromso Mine Victim Center in the 1990s in landmine contaminated regions of Iraq and Cambodia trained not only laypersons, also pre-hospital providers, but regardless, over a 5-year period, in doing so, reduced trauma-related death in their study catchment area from about 40 to 15%. And yet this hasn't been continued systematically. So clearly there's an implementation challenge. We identified one potential opportunity to address that by partnering with humanitarian mine action organizations who already work in communities affected by the threat of explosive ordnance to deliver what they call explosive ordnance risk education, which is a type of injury prevention, put in other words. And so we thought if we partnered with such organizations to deliver not only explosive ordnance risk education, but also layperson first responder trainings, this would be a perfect platform to scale this in conflict and post-conflict settings globally. We didn't want to reinvent the many curricula that exist. Strategically, we wanted to stay aligned with WHO materials. Practically, we found that their off-the-shelf package was not feasible given the real stringent challenges in our context. So we discussed with them and obtained authorization to adapt it as long as we were transparent about those adaptations to keep it strictly trauma focused, only those things most relevant to blast injury. And we piloted it in Burkina Faso, which is a country in West Africa in the Sahel that is unfortunately quite affected by the threat of improvised explosive devices. We use a training of trainers approach. Our partners are local doctors, and then on the mine action side, Mines Advisory Group. And our local doctors train community focal points. They might be health workers, otherwise they're respected community members, and they return to their communities to then deliver these trainings. We have been so impressed with the results, and they are so quick to acquire the skills that we're teaching. Their aptitude doesn't correlate with their relatively low level of education, but I mean, these are people who have to be extremely resourceful and extremely effective to survive every day, and that has really translated to their ability to learn these skills.
Salut, je suis le docteur Boko Fabrice et voici mon collègue docteur Sixte Bingboure. Salut. Ok. Nous sommes les collaborateurs de docteur Anna Wilt sur le projet de formation des secouristes communautaires en abrégé CFA.
Au cours de nos formations, nous utilisons un langage qui est moins soutenu pour permettre à toute personne, même n'étant pas du domaine de la santé, de pouvoir mieux comprendre et mieux assimiler les gestes. Il faut également noter que nous sommes souvent soumis à des contraintes, notamment au niveau de la barrière linguistique, mais avec l'appui de certaines personnes, nous arrivons à faire passer le message. Il faut noter que le but ultime de cette formation, c'est de pouvoir permettre au CEPA de prendre en charge les patients avec les moyens de bord. Ils arrivent déjà à déterminer ce que c'est qu'une urgence, à pouvoir mettre en place un garrot, par exemple, pour arrêter un saignement, à faire une attelle avec les moyens de bord et à assurer le transport des patients vers les services de santé.
Et même, il y a eu des communautés qui sont venues en aide à d'autres personnes qui en avaient besoin et qui souvent blessées, soit par des mines ou soit naturellement. Par contre, il y a eu des défis. Il y a le défi sécuritaire qui nous permet pas d'aller un peu partout et qui nous amènent à déprogrammer certaines activités. Nous aimerons tout le temps qu'il y ait aussi, en tout cas, des séances d'apprentissage qui nous permettent d'approfondir et de mémoriser convenablement les gestes. Merci.
Merci beaucoup. Merci beaucoup.
Thank you for your time and express my openness to further discussion of this topic or collaborations. Thank you.
you.